What if one of the simplest and cheapest interventions could dramatically improve recovery outcomes in hospitals across the country?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're diving into how a vitamin D protocol at Vibra Hospital in North Dakota led to faster recovery, fewer infections, and measurable improvements in patient health. I'm joined by Ilara Sky. Together, we'll walk through the hospital's approach, the data behind the results, and why maintaining adequate vitamin D levels is far more important than many realize.
Vitamin D deficiency is common, especially in northern climates with limited sunlight. At Vibra Hospital, 44% of patients had levels below 20 nanograms per milliliter. Many hadn't been outside for weeks and had little to no sun exposure.
That prompted the hospital to introduce a structured vitamin D protocol. Each patient had their vitamin D levels tested upon admission. Based on those results, they received personalized dosing aimed at reaching a therapeutic target of 50 nanograms per milliliter, follow-up testing at 25 days, or discharge allowed for adjustments.
They used the grassroots health calculator to determine both a bolus and a maintenance dose. Dietitians coordinated closely with physicians to monitor progress and ensure patients stayed within safe limits.
What stood out most was how many patients had critically low levels. Nearly half were under 20 nanograms per milliliter. Some had levels so low they were undetectable. These numbers highlighted how little attention vitamin D status typically receives in conventional care.
But outcomes changed once levels were corrected. Central line-associated bloodstream infections dropped to 0 in 2024. Catheter-associated urinary tract infections declined sharply, with one full year reporting no cases.
While other factors played a role, like hygiene updates and earlier catheter removal, staff noted a clear link between restored vitamin D levels and the drop in infections. The impact extended beyond infections.
Patients began healing faster. One brain-injured, ventilator-dependent patient regained consciousness and was transferred to rehabilitation after vitamin D restoration. More patients were discharged to home or rehab, and fewer returned to higher-level care.
Hospital stays were shorter. No cases of vitamin D toxicity occurred, even when doses reached 50,000 international units every 48 hours for several weeks. That's because dosing was based on lab values and continuously monitored.
Staff even began checking their own levels. Nurses from sunnier climates described mood changes during winter, which improved once their vitamin D levels rose. The program's success drew recognition from the North Dakota Department of Health and Human Services for dramatically reducing hospital-acquired infections.
The broader benefits of vitamin D go well beyond hospitals. Maintaining levels between 60 and 80 nanograms per milliliter supports immune strength, cardiovascular health, hormone balance, cognitive function, and blood sugar regulation.
Vitamin D improves muscle strength and coordination. In older adults, it helps reduce falls and supports recovery. It regulates calcium, reducing arterial calcification and lowering heart attack risk.
It also influences brain health by regulating neurotrophic factors like NGF and BDNF. That helps protect neurons, support learning, and reduce the risk of age-related cognitive decline.
Vitamin D regulates immune balance and may reduce autoimmune activity by guiding T-cell responses. It's been linked to reduced risk of conditions like multiple sclerosis, rheumatoid arthritis, and lupus.
There's also a metabolic effect. Vitamin D improves insulin sensitivity and glucose control, helping patients with prediabetes or type 2 diabetes lower fasting glucose and HbA1c.
Cancer risk is another area. Higher vitamin D levels are linked to lower rates of several cancers, including colorectal, breast, and prostate. It influences cell growth and differentiation.
And in terms of hormone health, vitamin D affects the thyroid, adrenal glands, and reproductive system. Low levels have been associated with Hashimoto's, PCOS, and menstrual irregularities.
It supports gut integrity by maintaining tight junctions in the intestinal lining, reducing inflammation, and enhancing microbiome balance.
So, who's at risk for deficiency? If you have darker skin, are over 60, live in a northern region, spend most of your time indoors, or have chronic health issues, you're more likely to fall short.
You can maintain levels with sun exposure, but there are important considerations. Stay in the sun just until your skin turns slightly pink, not red. That's your threshold. Don't burn.
If your diet includes vegetable oils rich in linoleic acid, sun exposure can cause more harm. These oils oxidize on your skin under UV light, increasing your risk of burns and DNA damage. Detoxing from these oils may take months, but it's necessary.
To protect your skin during this detox period, you can use topical niacinamide. Take astaxanthin and use a baby aspirin before sun exposure to block harmful oxidation pathways.
If you need to supplement, test your blood first. Use that level to calculate your dose using tools like the Grassroots Health Calculator. Your ideal range is 60 to 80 nanograms per milliliter.
Always take vitamin D3 with healthy fats like ghee or egg yolks. And don't forget cofactors, magnesium and vitamin K2. Without them, you'll need more vitamin D to get the same effect and may increase your risk of calcification.
Most people should take 180 micrograms of K2 and 400 milligrams of magnesium per 5,000 IU of D3. Retest every 3 to 6 months to stay on track.
Here's your challenge. If you haven't tested your vitamin D level recently, make that your priority this week. Knowing your baseline is the first step toward achieving real, lasting health improvements.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.